Hello, my dear viewers. My name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today we're going to talk about lowering cholesterol. We all know that high cholesterol brings the atherosclerosis. Atherosclerosis is clogged vessels, a lot of complications like myocardial infarction or strokes or pain in the legs or even gangrene. That's why let's talk about how to do it naturally, because we know that drugs are they're strong, they're effective, but they have a lot of adverse reactions. Can we do something to try to lower our cholesterol naturally? So that is the topic for today. Let's get started. And of course, first of all, look at the screen, please. Lifestyle and dietary changes. It's the first step to do in order to normalize cholesterol. This is often recommended before or alongside with any medication. First of all, diet. We know that many foods contain cholesterol, but the purpose of diet is not to lower the food containing cholesterol. Why? Because our body produces a lot of cholesterol itself, and if it lacks in food, it will produce more. The purpose of diet is not to allow the inflammation to occur, because inflammation and damage to blood vessels will cause this cholesterol to go there and stay there and cause atherosclerotic plaques, decreasing their blood flow. And second, we can modify our diet to increase the products that will absorb cholesterol that comes into the gut or comes with our bile into the gut, and not let it reabsorb, go back and circulate back into our body from our guts, and remove it with stool. So, what products should we limit? First of all, you must limit, of course, red meat, full-fat dairy products, processed meat, and palm oil. Next, increase soluble fiber. It will absorb cholesterol and remove it from your body. Soluble fiber binds to cholesterol, and cholesterol goes to the toilet. Sources are oats, barley, beans, lentils, apples, citrus fruits, carrots, and psyllium husk. By the way, psyllium is the first line laxative for constipated people. But as you see here, if you're not constipated but have high cholesterol, psyllium can potentially also help to decrease it. Next, incorporate healthy fats. First of all, unsaturated fats. Replace saturated and trans fats with these. Sources are olive oil, canola oil, avocados, nuts, almonds, walnuts, different seeds like flaxseed, chia seeds, and of course omega-3 fatty acids that lower triglycerides and have heart protective benefits. The main sources are, of course, fatty fish and walnuts, flax seeds, or supplements. Next, eliminate your trans fats, all fried foods, many margarines, some commercially baked pastries and crackers. Limit saturated fats. This directly raises your so-called bad cholesterol. We talked about it here already. Limit red meat, full fat dairy, processed meat, and palm oil. And add plant sterols and stanols. These are plant compounds that block absorption of cholesterol in the gut. We'll talk about it in the next slide. And choose lean proteins like fish, skinless poultry, legumes, and tofu. Before talking about sterols and stanols, let's talk about importance of physical activity. Regular exercise is a powerful tool. We need aerobic exercise, at least 150 minutes of average intensity exercise like brisk walking or cycling per week. in general, like, for example, 30 minutes 5 times a week. This physical activity raises good HDL cholesterol and can help to lower bad LDL cholesterol and triglycerides. It can also help with weight management. By the way, losing even 5 to 10% of body weight if you're overweight can significantly improve your cholesterol levels. Next, very important, smoking cessation, of course. Quitting smoking improves good cholesterol, HDL, and benefits begin almost immediately. And within a year, your heart attack risk decreased in half compared to smoker. Next, alcohol. Even we know that moderate consumption of alcohol may be linked to higher HDL or good cholesterol, their benefits are not strong enough to recommend drinking. Excessive alcohol, on the other side, may increase cholesterol, triglycerides, and blood pressure. Next, medical interventions. Sometimes the levels are very high, or there are already complications, or already severe atherosclerosis. Then, of course, medicines may be needed. Let's take just a very short look. There are statins. They are the most effective and commonly prescribed. You see here atorvastatin, rosuvastatin, simvastatin. They are very effective, but they have adverse reactions. And other cholesterol lowering medications. Some decrease the absorption of cholesterol in the gut. The others remove bad cholesterol from the blood. Bile acid sequestrants help to bind the bile acids, so this cholesterol, when it gets into the gut during digestion, does not go back into the blood, so the body loses cholesterol. And you see here even high doses of vitamin B3, but side effects are common. These are prescribed by the doctors. We're not talking in details about the medicines now. What are we more interested for today is a natural way of lowering cholesterol. And let's cover the topic of sterols and stanols from the plants. These are natural compounds found in cell membranes of plants. How do they work? In your small intestine, there are limited receptors for binding and absorbing cholesterol from diet or from bile. Plant sterols and stanols are structurally very similar to cholesterol, and they will attach to these receptors, and these receptors will be already occupied, and cholesterol cannot be absorbed anymore. So cholesterol is removed from the body as waste. There is extensive research. A lot of clinical trials and meta-analysis show that these are really effective. 2 to 3 grams per day of these sterols and stanols are recommended, and they can help to reduce cholesterol levels by 6 to 15% naturally. But they don't have any effect on HDL or triglycerides. What are the natural sources of these? In small amounts, they are contained in vegetables or vegetable oils like corn or canola oil, nuts and seeds, whole grains like wheat germ and bran, legumes, and in very tiny amounts in fruits and vegetables. A typical Western diet provides approximately 0.2 to 0.4 grams per day compared to 2 to 3 grams are recommended. It's like 10 times less. Good news that some manufacturers, they fortify the foods with these sterols and stanols. Here, consistency is crucial, because you need to consume it every day, regularly, to have this cholesterol lowering effect. And they are most effective when consumed with meal, because during digestion, when we eat something, the bile goes into our guts to help digestion, and there is cholesterol there, and afterwards it will be reabsorbed. So at this time, to lose this cholesterol maximally, we need to consume these sterols and stanols. The most concern about them is that they can theoretically lower the absorption of fat-soluble vitamins like A, D, E, and K. So you can eat a lot of colorful vegetables, carrots, and fatty fish. to counteract this effect. What about the natural remedies for cholesterol lowering? Of course, first one is garlic. It may inhibit or block cholesterol synthesis in liver, meaning body production of cholesterol. Studies have shown some mixed but generally positive results. A meta-analysis showed a moderate 5 to 10% reduction of cholesterol, especially if consumed raw or as the aged supplement over a long period, like over 2 months. Again, must be regular. Turmeric or curcumin, it may also help to lower cholesterol. Several studies suggest it can help with bad cholesterol and total cholesterol, while rising good cholesterol or HDL. Ginger may reduce the absorption in the gut of cholesterol. A 2018 meta-analysis showed that supplementation with ginger may lower bad cholesterol, total cholesterol, and even triglycerides. So you can add fresh ginger in food, tea, or use it as supplements after consulting your doctor. Fenugreek seeds, it is very high in galactomannan or high in soluble fiber, and this fiber absorbs cholesterol and removes it from the body. And human trials showed it can help to reduce total cholesterol and bad cholesterol, LDL. Artichoke leaf extracts contains the compound called cynarin that may increase the bile production, and the liver will lose more cholesterol with this bile. And several randomized controlled trials on humans have shown that it can lower LDL and total cholesterol. Bergamot can also block production of cholesterol in the liver, like statins, like the drugs. Promising studies, particularly from Italy, showed that it can decrease LDL and total cholesterol and increase HDL, good cholesterol. You can drink tea, for example, juice, or take as supplements. Next, berberine. This is the compound found in several plants, like golden seal and barberry. Often it's called a natural's statin. Multiple studies showed it's highly effective in lowering LDL and triglycerides. But caution, it is very strong, it is effective, and it has significant drug interaction potential. It can interact with other drugs the person is taking, such as cyclosporine. That's why, particularly if you consider taking berberine, you must always discuss it with your doctor. Of course, medicinal mushrooms like reishi mushroom, animal and some human studies suggest reishi can lower cholesterol. Shiitake mushroom has erythaddenine and is rich in beta-glucans. In studies, it showed to block cholesterol production. Eating shiitake regularly can help to control cholesterol. Oyster mushrooms contains lovastatin. It's a cholesterol lowering substance, and studies also show that it can help with lowering total cholesterol and LDL. And also maitake mushrooms shows a beneficial effect in small studies. And of course, I told you already about psyllium husk. This is fiber, soluble fiber, that can absorb cholesterol and remove it from the body. FDA has approved a health claim for psyllium in heart disease. Taking 10 to 12 grams per day may have good benefits on cholesterol. Of course, flaxseed, we already talked about it. It's rich in soluble fiber, in alpha-linolenic acid and omega-3 fatty acid. And in clinical trials, it showed some modest cholesterol lowering effect. Eggs. This is the great cholesterol debate, whether eggs can increase your cholesterol. Because we know that egg yolk is very rich in cholesterol, and for decades the logic was simple. That means eating this egg yolk will increase your cholesterol. The current understanding is that for most healthy people, the effect is very modest. What are we more worried about is rising saturated fats. But 25 to 30% of population are hyper-respondents, meaning their blood cholesterol will rise more significantly when they eat dietary cholesterol. What is good? Eggs also increase good cholesterol, HDL, that is protective against atherosclerosis. In general, meta-analysis tell us that, okay, 1 egg per day is safe and is not associated with any increase in heart risks. Especially eggs are a fantastic source of protein, vitamins, choline for brain health, lutein for eye health. And what about green tea? Green tea is widely regarded as beneficial for cholesterol and for heart health. It contains catechins, potent antioxidants. The most studied is, of course, epigallocatechin gallate. Multiple meta-analyses of randomized controlled trials show us that it significantly lower total cholesterol and LDL. The effect is modest but consistent. They block the production of cholesterol in liver and improves its removal from the gut. 2 to 4 cups daily are the most effective. Matcha green tea is powdered whole leaves. It's even more concentrated in catechins, or you can take supplements. But just green tea is safer, because we know that very high doses of supplements, for example, show us rare cases of liver toxicity. So brewed tea is the best. What about coffee? Coffee is a double-edged sword. It depends how you brew it. The culprit, natural oils in the coffee bean. Coffee beans contain compounds that can increase cholesterol. They can block the liver ability to remove it from the blood. And if you have high cholesterol, you need to avoid unfiltered brewing methods, because oily compounds of the coffee get directly into your cup. Examples: French press, Turkish coffee, brewed coffee, like Scandinavian type. Example: drinking 5 cups of French press coffee per day for 1 month can raise your bad cholesterol by 6 to 8%. Lowest in cafe stall or safer for cholesterol are filtered methods. Paper filter, it traps almost all this caffeine and caveol. So paper filtered coffee doesn't have any effect on cholesterol. Something in the middle is espresso method. It contains moderate amounts of this caffeine. A single shot has relatively little, but drinking little effect, but drinking many may cause some increase in cholesterol. And loading your coffee with sugar or fatty milk can negatively impact your cholesterol levels, independent of coffee itself. Dear friends, I hope it was beneficial for you. I hope this information will help you to maintain your health. I hope it will help you to maintain your health. Thanks to everyone who share these videos, who support this channel. You can see their names on the screen. And thanks for your comments. I really appreciate your activity and your time. I wish you all the best and good luck. Have a nice day. Goodbye.
Don't be afraid, doctor.